Okay, let's talk about another application of breast thermography, and that's called monitoring or surveillance. What we're looking at here is the ability to monitor things over time. And with a breast thermogram, since it's measuring physiology, the temperature patterns that we're visualizing could actually change over time. And this could be beneficial in a few ways. Number one, from a risk assessment standpoint, we could see if the risk is increasing or decreasing. That might be due naturally over time, or you may be monitoring an intervention that you're doing, a lifestyle change, a diet change, or a holistic treatment. In either case, the thermogram can be used to help determine the effectiveness of what you're actually doing to see, did it change the breast physiology for better or worse? The second thing that we can do in terms of surveillance is monitor whether the risk is increasing and changing over time from the standpoint of detection. Certainly, breast cancer is something that can be very sneaky, and it could appear in between mammograms, it could be in between other tests. So by incorporating thermography and looking for these subtle changes that come over time, we may be able to detect a process that suggests cancer could be developing and coordinate those other tests to make sure that it's caught at the earliest possible time. The last thing that can be done with thermography in terms of surveillance is monitor an existing cancer, whether it's under treatment via chemotherapy, or whether it's something like a DCIS, which may be non-treatable in some cases. Sometimes they are just being monitored, but we could still watch the physiology to see if it seems to be improving or getting worse. Again, all with the idea of getting that information back to the doctor, coordinating the care so that everything's done in the most effective manner as possible. That's what we mean by monitoring or surveillance.